Welcome to International Medical Corps' update on our response in Ukraine. I'm Rebecca Milner, International Medical Corps' Chief Advancement Officer. We are delighted that you've joined us today. Many of you on the call have generously supported our work over the years, and in particular, our response in Ukraine. We are incredibly grateful for your trust and commitment. Your support makes our work possible, and together, we're able to make a real difference. Thank you. We're going to keep today's briefing as efficient as possible. We'll wrap up in about 45 minutes. And toward the end of our conversation, we'll take questions from the chat. So as we talk, please feel free to type in your questions and we'll do our best to get to them. As you know, yesterday, Ukraine celebrated its Independence Day, a day which also marked the 6-month anniversary of Russia's invasion. The war shows no signs of abating. You may have read about the rocket strike on a railway station yesterday, killing dozens of civilians. Thousands more people are evacuating their homes in the eastern part of the country, and scores of damaged buildings require repair with winter approaching. Safety concerns are also growing over the military activity around the Zaporizhzhia nuclear power plant. The UN estimates that 17.7 million people, more than 35% of Ukraine's population, require urgent humanitarian assistance. Throughout the past 6 months, our team has worked tirelessly to support and restore health services across the country and to provide assistance to those most impacted by the conflict. In Ukraine, Poland, and Moldova, we've reached more than 3 million people so far. We are supporting 125 health facilities and 5 displacement centers. We've delivered more than 480 tons of medicines and medical supplies, and we are implementing a number of programs helping families affected by the conflict. We have roughly 250 team members in Ukraine and extensive operations across the country. I'm very happy to welcome 2 of our colleagues who are on the front line to share more about conditions on the ground and update us on our response. First, let me introduce Dr. Javed Ali. Javed is our Senior Director for Emergency Response and our Ukraine Response Team Leader. A medical doctor, Javed has more than a decade of experience working in humanitarian emergencies. He's been on the ground in Ukraine since shortly after the war started. We also have Dr. Engels with us today. Michelle is a clinical psychologist with more than 10 years of experience working on mental health issues in humanitarian settings. Michelle is leading our mental health programming in Ukraine, a key priority given conditions on the ground and how critical mental health is to people's overall health and well-being. Welcome to you both. So Javed, I'm going to start with you. You crisscross the country regularly. Where are you calling in from today?
Hi, thanks, Rebecca. Thanks a lot for having me, and it's good to be here again. And before I start, I want to thank everyone who has supported us in our work. And as you have mentioned, the situation on ground is still dire. The country is still at war, and we are still struggling to reach all those individuals who are in need of humanitarian assistance. I'm currently based in Kiev. I've been in Kiev for almost 4.5 months and in country for a little over 5 months. And usually we have about 7 different programmatic hubs here. So I travel back and forth with, between all those different locations.
Yeah.
Currently, I'm in Kiev.
Okay. Well, we just threw up a map of the country. I mean, Ukraine is a big country with different needs in different regions, and each has been affected by the war slightly differently. Can you tell us a little bit more about our approach and how we're adapting our programs to meet each of those specific needs?
Right. So I'll just explain a little bit. Briefly in terms of what our strategy is in the country and how we are operating. So our strategy in Ukraine, like in most of the emergencies across the world, it's a multi-sectoral response. However, Ukraine, in terms of its geographical challenges and in terms of the context across the country, it varies quite considerably in terms of needs when you move from west to the east and as well as from the north to the south. So as such, our response activities are developed in congruence with the prevailing insecurity, access, the needs that are assessed across these regions, and as well as certain other determinants, including operational feasibility, availability of manpower, and security of our teams on ground. So as such, when we started looking at rolling out our programs, we looked at the macro geographical locations in Ukraine. And these macro regions include the northern region, which includes Kiev, Chernihiv, and Sumy towards the northern part of the country. These oblasts, as they call them in Ukraine, were occupied by the Russian forces, soon after the invasion started on 24th of February. And then we are also active in the eastern region of the country. These are areas that are still in quite active conflict. This includes the Luhansk region, Donetsk, and parts of Kharkiv Oblast. In the south, again, I mean, these are here you would see as it's illustrated in the map. There are oblasts that are at high risk of this escalated conflict. This includes Mykolaiv and to some extent Odessa as well. And then you have Zaporizhia, and Kherson, which are still quite in active conflict. And then you have the general western region. There are no active conflict hotspots at this particular moment, but the humanitarian situation is rather different and quite dire, to be honest, because of all this conflict towards the eastern part of the country and the southern part of the country. There's a mass displacement of population settled in Lviv region in particular, where we are operational. So in order to respond to these needs, we established 7 different programmatic hubs from west to east. We are based in Stry and Lviv region, where we are largely responding to the needs of the displaced population. There's a large displacement pocket in that particular region, and we are focusing largely on mental health, protection, cash-based programming, WASH, etc. In order to meet the needs in the northern part of the country, we are based out of our country program office, which is established in Kiev, along with a sub-office for emergency response in Chernihiv, from where we manage programs both in Kiev, Chernihiv, as well as Sumy and Kharkiv. Towards the south, we are established in Odessa with an emergency response team that is catering to the needs of the population, both in Odessa Oblast and as well as the neighboring Mykolaiv. And then in Dnipro, we have an emergency response hub from where we are responding to the situation in Donetsk and Lugansk, and as well as in Zaporizhia. So our primary aim in this response is to enhance access to essential services, including health, mental health, and other sectors that I mentioned earlier. And given the various operational challenges in the country, we adapt and tailor the package of services depending on all those determinants that I mentioned, operational feasibility, right, access, security, et cetera. So we do have this hybrid model of intervention, where we also in most of these areas directly implement our program. In certain other parts where either access is compromised or we have local partners who can deliver the programs, then we have these sub-awards with these local partners to actually deliver these programs.
Right. And I mean, and even though it's an active conflict and war is affecting the south and the eastern part of the country, I mean, we're already starting on rehabilitation efforts, right? Because right, of the formerly occupied areas like in the north. So we're doing our best to kind of restore those health services in that region, right?
Right. So all these regions, and that was the reason behind our this hybrid modality of intervention. So the north generally comprises of these, as we call them, liberated areas. So the region has because of the invasion has been severely impacted by a number of issues, including destruction of infrastructure, including that of health facilities, and as well as water and sanitation infrastructure. And,
right. The World Health Organization's reported that there have been over 460 attacks on health facilities, right, directly, right?
Right. So that is spread across the country. So when you look at Kiev region, particularly, in Kiev, there are more than 15 facilities that were directly impacted, and this region was occupied just for 4 weeks. It's the same situation in Chernihiv, where we have seen a number of health facilities either completely destroyed or destroyed to the point that they're not usable anymore. In Kharkiv, the situation is totally different. There are more than 50 health facilities that have been totally destroyed. Similarly, in other parts of the country that were occupied, we see a similar picture. So as such, one part of our response was to actually rehabilitate these health facilities so that we can restore functionality of these healthcare services in these areas. So we did a couple of things early on in our response. We identified all those facilities where there were large catchment populations that were dependent on them. Those facilities are in different phases of rehabilitation. Similarly, there is this network of family doctors who in Ukraine are supposed to provide door-to-door services. Those are the mobile wing of the Ministry of Health. Those doctors had lost their vehicles because of invasion, because of damages during this invasion. So we also provided family doctors both in Kiev and Chernihiv with vehicles so that they can reconnect themselves with those communities. So in terms of the impact on health service delivery, it has been massive, from infrastructure damage to wash infrastructure, as well as lack of supplies, material, lack of ancillary services, which has been quite a major factor in this region. So the lab services under the Ministry of Health are, even till date, they have not really regained their functionality. So we're also providing lab services. We didn't intend to in the beginning, but when we saw the need, we started establishing these laboratory systems in these health facilities. So we have that activity currently ongoing for all the health facilities in Kiev Oblast, and we're extending into Chernihiv. So all in all, yeah, the impact on health service delivery has been massive, directly and indirectly as well, because there has been loss of healthcare workforce, there has been loss of material, and on top of all that, the overall service governance for these healthcare facilities has also been largely impacted. So that has led to reduction in both access and availability to the healthcare services. So that's what our focus is, and it will remain to be our focus for the next 3 to 6 months until Ministry of Health is able to step up and manage these facilities. And then the other thing we did was we witnessed that in certain areas, the facilities were damaged to the point that restoration was not possible. That's where we contracted private healthcare service providers here, and we ensured that those service providers establish these healthcare facilities from where the communities who were left behind or who were returning to their areas would avail services. So those were a couple of things that we did. On top of it, we are also thinking about connecting people on the front lines with health services by implementing telemedical network in these. And so there are a number of activities that we are involved with, and the spectrum is quite wide, but for the sake of time, I'll stop here.
Right.
If you have a follow-up question to that.
Right. Well, we can dive into some of the direct services that we're providing. I mean, Michelle, maybe tell us where you're calling in from today.
Yeah, hi everyone. So I'm actually normally based in Kiev, but I'm joining from Leszno, a town in Western Poland. IMC has been supporting a conference here, and at the conference we've been able to bring over 100 Ukrainian psychotherapists together with more than 100 Polish psychotherapists, and then 100 more from all around the world to just share expertise, share experiences, and really explore this concept of mental health during times of war. And we've facilitated 2 workshops here. One is looking at caring for yourself as a healthcare provider, because a lot of the psychotherapists themselves are members of the affected community. So it's about how can they support themselves so that they're able to then support other members within their community. And then the other one was exploring their role as trainers and supervisors. So it's been a really special week, actually. Quite a full social calendar as well, lots of opportunities to share in the culture of the Ukrainian people and lots of singing Ukrainian folk songs. It's been really nice.
Oh, how lovely. I mean, we've talked a lot about the physical destruction of the health facilities and the decimation of communities. I mean, it's easy to talk about those physical impacts of the war, but as one of our key priorities is to provide mental health services to conflict affected communities. I mean, can you maybe explain for our listeners a little bit about our approach to that, because it's slightly different than what I think we think of mental health in the Western world?
Yeah, I mean, IMC does have that history of providing mental health support during times of conflict. And we have experience as well providing mental health support in Ukraine, especially within the eastern region that has experienced conflict for a number of years now. And you're right, the physical impacts of war are often the most visible. But one thing that's been really interesting about Ukraine is as soon as you start speaking to members of the community or speaking to staff working there, one of the first things that they mention actually is mental health needs. So it's highly visible here. One example is, we were talking to a doctor in a primary healthcare clinic, and we were just discussing the types of challenges that he's facing in his role. And he's talking about mental health needs of his community. And then he said, and for me, it's the same. I go home and I reach for a bottle of whiskey, and that's how I cope. Mm-hmm. So this is something that we're hearing a lot. It's quite common. In terms of IMC, how we support, we focus really on, doing a lot of training and a lot of supportive supervision of existing experts that are already within country. And we try to really establish partnerships as much as possible with institutions who already have that presence and reach within their community and support them in their role. We're seeing a lot of grief and loss, a lot of addiction, like I mentioned, increasing rates of suicide as well. So these are all topics that we focus on in conflict settings.
Well, what's the view of, I mean, I know that it's a priority in Ukraine and people are talking about it, but what's the view of mental health services in Ukraine? Is there stigma attached for seeking care?
Yeah, stigma is still quite prevalent within Ukraine. And that's something, before we started our activities here, we did a massive, like a rapid needs assessment to really speak to the community and identify what are the core needs. In all of our discussions, actually, stigma was constantly mentioned, not just by community members, but also by healthcare professionals themselves, not feeling confident when they're working with people with mental health conditions, but also holding, perhaps, some beliefs around people with mental health, just common things that we know are not true, but misconceptions around it. So it is something that is still quite widespread. The way we try to address that. Oh, sorry, no, you go.
I was just going to say, you were probably going to address this question. I mean, isn't that why we try to integrate it into the primary healthcare setting so that it feels like it's less, I don't know, there's less stigma to attaching to seeking services?
Yeah, we try to tackle it a number of ways. And one of it is by integrating within existing healthcare services, also integrating it within existing community structures, so that it's not like a standalone mental health clinic necessarily where people go to that does have a lot of stigma attached to it. Mm-hmm. Another way that we try to address it is by training professionals so that they, start to explore those common misconceptions around mental health, and we provide information, accurate information around it. And we try to as well do a lot of communication campaigns to the community. So really promote positive coping messages and really help to understand that at times of war especially, it's normal to experience distress. These are normal reactions to quite abnormal and abhorrent events. So just really getting that message out there and helping people to identify when they need to access support and then how to access it.
Right. I mean, Javed, Michelle mentions the training, working with local providers to help strengthen their capacity and help them with self-care and all of that. I mean, training underpins all that International Medical Corps does. I mean, maybe you could talk a little bit about some of the training activities that we have that are related to direct health services, because I think it's quite interesting, some of the things that you're doing.
Right. So when we started, conducting our training needs assessment in the country, well, first of all, like I said, the country at that time was at war. So there were a number of health facilities on the front lines that were completely overwhelmed with the number of trauma patients that they were seeing. There were, these EMS services that were constantly, taking patients from the front line to different hospitals. And then the whole apparatus under civil defense was involved in this response effort. So when we started interacting with the health providers, we witnessed, and it was actually brought up, that there's a need to actually develop this workforce with training so that they have necessary set of skills to actually respond to this emergency. So we started looking at different potential options, and we came up with a curriculum that includes preparing health facilities for trauma, where we work with these frontline healthcare facilities on mass casualty event management. We train the doctors on different aspects of dealing with mass trauma. We work with the staff from civil defense on stop the bleed training when they actually go on either on the front lines or a site where there has been a recent explosion, to pick up those patients and transfer them to the hospital. We have a training curriculum that is for the nursing staff who are working in these health facilities, focusing on trauma and nursing fundamentals. And on top of it, this is a country where 3 decades ago we saw a massive nuclear spillage, and there is also a likelihood that we might see that again, given the escalated conflict in the southern part of the country, in particular in Zaporizhia, where there is the largest nuclear reactor of Europe. And there are concerns about the integrity of that particular facility. So we integrated, CBRNE training, which focuses on, chemical, radiological, nuclear, and explosive.
Right. I mean, these aren't common things that your primary healthcare doctor would deal with, right? Or the nurse that gives you your vaccine shot or your vaccination or your immunization would deal with. So, so I guess, so the strategy was really to quickly provide that support around trauma care, and then also some of that specialized training that might have to do, CBRN training. I'm not sure that in the United States, our doctors and nurses would know how to deal with that. It's highly specialized, right?
Exactly. And in order to get that done, we had to look for a strategic partnership. We worked with Harvard Humanitarian Initiative to actually develop that training curriculum. We brought trainers, subject matter experts from the States to come in to the country to provide that training. So far, we have trained close to 300 healthcare workers, and now we are taking that training from Kiev to Dnipro. The intention of the training is to actually come up with this cascade mechanism where you train the doctors and the nurses and the frontline healthcare workers, so that they can also cascade that training for staff who we cannot reach otherwise. Okay. So that has been the intention, and we have been quite successful in our endeavors so far, and now we are trying to take that training to different locations, since the staff cannot really come to right. Kiev, which
to a central, right,
to a central location. So we'll go around the country training healthcare workers for the next 3 months, while simultaneously assessing other training needs in these health facilities.
Mm-hmm. And then just speaking of preparedness and training, maybe you could describe for our listeners a little bit around helping facilities prepare for potential rocket attacks or strikes, or prepare for conflict. Right.
So we have a number of initiatives where, like I mentioned earlier on, our package of services is tailored to the context. So when we look at Odessa, for instance, and Mykolaiv, and on the northern part, to Chernihiv, there are areas that are constantly being shelled, particularly in Chernihiv. And in Odessa, we do expect that at some point the conflict perhaps would reach the shores of the city. So in order to prepare effectively, we have started working with various health facilities across these three different regions to prepare them in case a situation like Donetsk or Mariupol ever comes. So basically, as part of this preparedness, there are a couple of things we are doing. One of it is structural, where we are working with these healthcare facilities to create sort of a remodeled bunker health facility within these existing healthcare infrastructure. On top of it, we are working with the hospital administrations to put in place mass casualty event management plans. And in order to treat the patients, we are also pre-positioning stock for triage, for dealing with acute critical emergencies and so on and so forth. So it includes workforce development, emergency trainings, it includes structural preparedness, it includes operational preparedness and administrative preparedness. So this is something that we are doing across all these areas where we do anticipate that at some point there might be an escalated situation. Similarly, in Kharkiv, there are also facilities that are on the front line that still require this kind of preparedness. For instance, in Kharkiv, we are working with the regional blood bank. It's a massive facility that serves the entire region and also the surrounding, oblasts or states, which are
right. You talk about the blood bank. I mean, maybe you could give people a little background on that. I mean, the staff members of the blood bank are super committed, right? I mean, they are determined.
Right. So maybe a little bit about Kharkiv. So Kharkiv is, is a very developed kind of an oblast. It used to be, the Kharkiv city was the previous capital of the country until a couple of years ago. It has almost 1.5 million residents, but because of its proximity with Russia, it was heavily bombed. It's still being bombed. 20% of the buildings are completely destroyed. There are more than 40-50 healthcare facilities that have been totally destroyed. But because blood is an utterly crucial and essential product, they couldn't really close the blood bank, despite the fact that they were shelled more than 20 times, in March and April, and they are still being constantly shelled. When this invasion started, the staff who were working in this blood bank, is a 3-story building. They shifted the whole setup to the basement. And now this basement is not meant to be a blood bank. So the structure is not at all, organized to serve as a blood bank. So those staff members since 24th of February have been living in this blood bank, about 90 in total. Out of them, about 75 are female, because most of the men have actually gone to the front line. So there are predominantly female staff who are actually working in the blood bank. There are a number of accounts where even when the blood donors who were walking into the blood bank, they were shelled and killed right outside the facility. So despite all that, we have been there a number of times, and we are currently working in rehabilitating that particular basement and protecting the whole building by putting in these sandwich panels to protect the staff. What we witnessed is that the morale of staff is really, really high, and they're extremely committed. They know how important their work is, and the fact that when you're dealing with a trauma patient, blood is an utterly crucial product, and they realize that. And despite all this shelling, despite the curfew hours, they are still going out to provide those blood banks and blood products to facilities that are on the front line. They're still going out to actually organize these blood donation campaigns. So it's amazing to see how heroic those people are. And we are also committed to support them. So we have provided them. So the vehicle was also damaged. The vehicle that they used to provide these packed blood products to the frontline facility. So apart from protecting the building and apart from rehabilitating and remodeling the basement, we're also providing a vehicle to collect blood from satellite blood donation units, and as well as to support and provide those blood products after they are filtered and packaged to the frontline healthcare facilities. And we have so far, and we're also aiming to improve, the patient circuit in that area. There's also a treatment zone for patients with thalassemia, patients who require regular blood transfusions. So those patients cannot really go home because, the situation in this particular region is so intense that they're afraid that they might not be able to get back because they require recurrent blood transfusions. So they're also living in the building,
Right.
and it's just the situation is quite
Amazing.
dire, but it's amazing how these people have sustained this service.
This incredible life-saving service, absolutely. Well, we do have a few questions from our listeners. I mean, and Michelle, maybe you can take this one and talk a little bit about Western Ukraine. And I mean, we've all heard that about 13 million people are displaced in Ukraine. I mean, 6 million to 7 million have left the country, but there is an equal amount of people displaced within the country, and a lot of them are in Western Ukraine. And maybe you could talk a little bit about conditions in Western Ukraine and what's going to happen over the next 3 to 6 months.
Yeah, absolutely. So we have a presence in Lviv Oblast, which Javed was talking about earlier. And we have MHPSS teams that have been connecting with community members there. And obviously we're seeing a lot of mental health needs, as we are across the country. But one thing that's quite unique for Western Ukraine is we're hearing more and more as time goes on about tension within the community. So in particular, those who are displaced, experiencing some tense relationships with the host community. And there's been some stories about that, like, I guess, like small everyday things. The displaced community doing their laundry on Sundays, for example, but the host community not being happy with that because for them it's a really important day within their religion. And just that slight difference in kind of how you practice religion or how your culture functions, even though they're from the same country, actually is leading to tension. And obviously, because of COVID, a lot of children have been educated online. This month is actually the first month where children are joining together physically in classrooms. So we'll have a lot of children who are actually mostly Russian speaking, who may not know the language of Ukraine, may not know Ukrainian. And that adds an additional dimension. So a lot of parents are expressing concern for how their children are going to cope with that. And a lot of persons who are displaced are expressing a sense of discomfort within the community.
Yeah. I mean, it's for those of us in the United States or in the West, we often think of Ukraine as, a one country, but the West and the East are quite culturally different. And as you mentioned, people in the East often don't speak Russian, right? And so with that large movement of people into the West, it has added tension in those communities. What are some of the things that we're doing, to help individual displaced families and host communities? Maybe you could talk a little bit, not only mental health services, but some of the other, maybe the cash assistance and things that we're doing.
Yeah, absolutely. Well, I guess in terms of supporting social cohesion, one of the most important things that you can do is just bring community members together as much as possible. So that's something that we've really been focused on, is identifying community spaces that are already being utilized, but then trying to encourage members from the displaced community to engage a little bit more and just bringing people together. And it doesn't necessarily need to be around formal mental health services, like you said. It could just be more creating opportunities to experience joy. Maybe it's something a bit more artistic in nature. So, that we've been trying to create those spaces and create those opportunities to bring people together and start, increasing positive interactions, I guess, between community members. And then, of course, like you mentioned, IMC has a very comprehensive approach to programming. So we support with other needs as well. And we've been providing basic assistance, not just to the displaced community, but to the host community that needs it as well. Because if you just provide support to the displaced community, you actually end up creating increased tensions. Mm-hmm. So it's something we have to be really mindful of.
So Rebecca, maybe I can add a little bit to that.
Sure.
I think from an emergency response perspective, when we think about displaced population, we generally look at the outstanding 10 to 14 different priorities. Food, shelter, and water being the top 3 priorities. Sure. So in the Western Ukraine, and as well as in other areas where we have these displaced individuals, we have done quite a few things. One is the shelter, ensuring that people have space to live with dignity. They have access to clean water, they have access to basic hygiene services, including hygiene products, and as well as provision of multi-purpose cash. That was highlighted based on a number of assessments that were conducted amongst the displaced population as one of the most outstanding needs. So that's why we also integrated multi-purpose cash programming into our response. Until date, we have reached about 5,000 individuals with a transfer of more than $1 million to support the displaced population in either paying for the rent or paying for the food, etc., etc. And on top of it, our WASH program in these areas is quite robust. Like I said, improving living condition is one of the priorities that we have, and as such, we have worked on improving the living spaces, provision of basic items, including NFIs, and as well as things such as mattresses or repairing the toilets, and
Sure.
and also training the individual, these displaced population, so that they can also play an effective role. So there are a number of things. One thing that we do not do in Western Ukraine is health, because we do not want to start parallel services. We support the hospitals that are operated by the Ministry of Health by providing them with items, equipment, and material, but we do not really focus that much on health service provision, because that need at least is covered by the structures that are operating under the Ministry of Health.
Right. We have another question about Mariupol, which was our main base of operations, since 2014, before the invasion. Can you talk a little bit about access in that area? And we're not able to. There's no access, right?
Access at this particular moment is impossible to Mariupol, because the whole region is completely cut off. It's occupied by the Russian, to the point that the whole administrative setup has actually shifted under the Russian administration. So the currency has been replaced by rubles. The rest of the bureaucratic structure under the governance system there is completely Russian. We do not have access to the region, but we do have some of our staff members whose family members are still there. And we have heard stories in terms of what is happening. So a large portion of the population is completely cut off from water. There has been massive loss of livelihood. Most of the people who were actually left behind in Mariupol, they were, retired, people or people with disabilities. So they do not really have any access to livelihood. So they're completely dependent on humanitarian aid, and there's no way that humanitarian aid would be able to actually reach Mariupol. So the stories that we have heard from our staff members, they are very, very, very concerning. And quite honestly, we don't really have a clear picture, but it's pretty dire. And that's all that I can say. But yeah, I think you can imagine what might be happening there.
Yeah, right. Another of our guests is asking about the appropriateness of donations, in-kind donations. And, that's something that we specialize in across our 30 countries. But what's the situation in Ukraine? I mean, are we able to import donated medicines and supplies?
Yeah, certainly. And I think we have been doing that right from the start of this response. We've generous gifts in kinds from a number of our supporters, including items, medications, equipment, material, as well as certain non-medical products. And under the current system, the country is still operating under martial law. So as such, importation is not that massive issue.
It's not too hard.
Yeah, a couple of items, but generally it has worked fairly well for us, and we have donated a number of those items that we received as gift in kind that were important in the country to beneficiaries. And recently, for instance, we received we received a number of kits. We received protective equipment that we donated in Mykolaiv region recently. And the system currently is still operational. So we'll see how that transitions once this martial law is lifted, which is quite unlikely.
Right. although any of our GIK related work is very strategic, right? I mean, I think as a humanitarian community, the double-edged sword of donated supplies is a reality, right? And so we're very careful to make sure that there's a match, right, between the donor and the recipient, which is something that's really important to keep in mind.
Right. I mean, after scanning all the needs across all these regions that we work, we created a list of items that are actually required, and we keep periodically updating that. And when we receive a donation, we check it against that particular list, and then we decide whether or not to bring it into the country.
Yeah. Well, I mean, we have just a couple of minutes left. I don't know, Michelle in particular, are there any kind of thoughts that you want to leave our listeners with that about, I know, either our priorities or what you're hoping to accomplish over the next 3 to 6 months?
Yeah, I mean, I think we have quite an ambitious 3 to 6 months ahead of us, but there's really a lot to achieve. I mean, like I said, we're working really closely with local stakeholders to try and make sure that we're best positioned not only to respond to immediate needs, but to also take a long-term approach. We were really fortunate. The First Lady of Ukraine, her office actually approached us because the First Lady of the US spoke to her about IMC and the MHPSS activities happening in Ukraine. So we're discussing with the Office of the First Lady in Ukraine how we can collaborate and how we can support. I think that's really important because from a long-term perspective, that helps us to kind of look at mental health strategy and really focus on making sure that community mental health is accessible throughout the country beyond this crisis as well. So I think, those conversations are incredibly important to continue. Having this focus on social cohesion in the West, I think is really important. And like I said at the beginning, really supporting the persons who are the first responders, really supporting them to do their role, whether that be through trainings or providing emotional support to them as well. So that's going to be our core focus moving forward.
Well, Javed, on the kind of countrywide scale, I mean, maybe you could talk a little bit about what you hope to accomplish in the next 3 to 6 months.
Yeah, certainly. I think as you mentioned earlier on, we have more than 100 facilities that we currently support. So that in itself is quite,
a big job.
Busy. Yeah. So we will continue supporting those health facilities. We have about 15 different healthcare facilities that are under various phases of rehabilitation and repair. We are racing against time here because, with the onset of winters towards the second half of October, we would not really be able to undertake any more construction work because temperature here really goes below 0. So we have to complete those. And we have a winterization project that focuses on provision of items, equipment, material, and as well as improving conditions in shelters where there are IDPs before the winter starts. So that is a massive focus for us, and we are focusing on, relatively sort of ignored regions, including Sumy, Poltava, Zaporizhia, these areas which are relatively less developed in terms of, the conditions there. And apart from that, one of the major focus that we have is to ensure that the hospitals in Zaporizhia particularly are prepared for any potential radiological or nuclear accident, given the fact that the likelihood is really high. So we'll continue training the health workforce in that particular area, and we'll work with the hospitals in that particular region to ensure that they are administratively, operationally, and as well as from supplies perspective, equally prepared. And similarly, towards the north, we have this trauma preparedness project that we have recently rolled out. We are doing assessments, we are selecting health facilities. So basically, the intention is to actually ensure that those health facilities are equally prepared to deal with any potential surge in trauma cases if the situation changes in this particular region, which is quite high in terms of likelihood. So those are a couple of areas on top of what we are currently doing in the country.
Right. Right. Well, we've hit the 45-minute mark. I just want to thank you, Javed, and you, Michelle, for joining us. And I really want to thank all of the guests that signed on and were so generous to International Medical Corps for our Ukraine response. We have a lot of work to do ahead of us, and we appreciate your partnership. And if you don't follow us on social media, please do. You can always learn more about our work on our website. And we will continue to hold webinars like this so that you can keep up to date with what we're doing. But a big thank you to all of you for your tremendous support of our work, and good luck, Javed and Michelle. We look forward to hearing from you in the coming months. Thank you.